Let me start by saying in relation to Cyclone Harold, which is of course severely impacting the Pacific right now, that my thoughts and the thoughts of the government are with the people of the Solomon Islands, of Vanuatu, of Fiji and now of Tonga as they face the extensive damage wrought by Tropical Cyclone Harold. There have indeed been a number of deaths in the Solomon Islands, and our condolences and sympathies go to the people of that country. There has been significant damage in both Vanuatu and Fiji. Tonga was hit by the cyclone this morning. It re-intensified to a Cat 5 level cyclone, and we are now assessing through Post and officials in Tonga what the impact has been there. It's fair to say we're acutely conscious that this comes on top of the impact and the difficulties created by COVID-19 for those countries, and so our support is all the more important. We're supporting the caretaker government in Vanuatu. They had an election recently to undertake their damage assessment, as well as with relief supplies such as tents and water containers. A defence flight will leave Australia today to deliver those supplies. I'm very grateful to the ADF for that support. We have already provided support to the Solomon Islands for their clean-up, and we have offered our support to the government of Fiji. And of course we stand ready to provide what further help we can to our Pacific family in whatever ways we can. I also wanted to note in relation to ongoing international discussions about COVID-19. I, of course, am in regular contact with my counterparts across the globe, maintaining extensive engagement with them to discuss these and other challenges. In recent days and weeks, I've spoken with a range of leaders, the Deputy Prime Ministers of New Zealand and Samoa, my counterparts in India, in Indonesia, in Malaysia, Papua New Guinea, in the Solomons, in Fiji, Palau, Nepal, the United Kingdom, to name a few, and in, of course, regularly exchanging messages and information with colleagues as well, so that we are able to compare notes on what is happening. There are also global coordination efforts to discuss and respond to the challenges that COVID-19 is presenting to us. This week we had the 5th meeting, a teleconference arrangement of at Foreign Minister level with counterparts from Canada, from Europe, from South America, the Middle East and other friends in the Indo-Pacific. Regionally as well, this week a special session of the Forum Foreign Ministers was held by Zoom to discuss cooperation on pathways for humanitarian supplies and services, and very much thank the Foreign Minister of Tuvalu, Simon Kofi, for his chairmanship of that, and the Pacific Island Forum Secretariat for convening it. In relation to our ongoing COVID-19 response internationally, I'm also very pleased to indicate today that we have finalised and secured agreement with Qantas to carry out special facilitated flights initially to 3 countries, to Peru, Argentina and South Africa. Those planned Qantas flights, which are anticipated to take place over the next week, follows on from another successful facilitated flight which occurred today, which is carrying about 280 Australians from Peru who are now on their way to Australia. I particularly want to thank Deputy Prime Minister McCormack for his support with the airlines in facilitating and helping this agreement to come about. The Australian Government is also assisting by ensuring that these flights have the necessary clearances and approvals in countries where Australian airlines normally don't fly. Some of this is new for Qantas, and so we are assisting with that process. It's also, I think, relevant to observe, for example, in relation to the flight that brought Australians back from Nepal earlier this week, was the first ever direct flight between Australia and Nepal, carried out by Nepal Airlines. And I may say I spoke with my counterpart, Foreign Minister Gaiwali, there to thank him for that support. We are also exploring similar options to facilitate flights from other destinations in the coming weeks, and they will include, I hope, subject to permissions in those countries, India and the Philippines. I've already mentioned Nepal, but we have ambassadors in places like Cambodia and Lebanon who have negotiated or are negotiating negotiating with airlines in relation to commercial flights to enable those to occur. As you know, the Deputy Prime Minister and I have also announced that the government has worked with Australia's two major international airlines, with Qantas and with Virgin, to establish a network to those four key international hubs, London, Los Angeles, Hong Kong and Auckland, across the next 4 weeks to help Australians returning. Over 6,400 Australians have, with assistance from the government, both here and importantly at posts around the world, safely disembarked 45 cruise ships and counting. That is an extraordinary level of international cooperation, and I acknowledge the support that we've received from so many counterparts in enabling those disembarkations and flights to take place. Of course, each country makes its own decisions about how to implement these processes. You know, we declared COVID-19 a pandemic 2 weeks before the World Health Organization did. We were one of the first countries to restrict travel from worst affected nations, including, of course, China and Iran. And I would remind everybody that as early as the 9th of March, we advised Australians to reconsider taking cruise ship trips at that time. On the 13th of March, we advised all Australians to reconsider the need to travel overseas. On the 17th of March, we advised Australians overseas who wanted to return home to do so as soon as possible by commercial means. On the 18th of March, we raised our travel advice for anywhere overseas to do not travel. And of course, on the 25th of March, the government put in place a travel ban on Australians leaving Australia, except for certain exemptions. So we've been very clear in our warnings and our advice. We'll continue to work on getting Australians home in a way that is safe for them and also safe for Australians in Australia. We're very mindful of our broader responsibilities as a government and the fact that many Australians need help right now, both abroad and, of course, at home. We are getting Australians home. We are harnessing our relationships overseas. We are leveraging our diplomatic network. We are working with our airlines. We will do all of that, taking into account the many responsibilities that the Australian government has in these unprecedented times. And no person has a greater responsibility, perhaps, than the Prime Minister, than the Minister for Health. And Greg, please, over to you.
Thanks very much to Maurice. We're joined by Dr Nick Coatsworth, who is a Deputy Chief Medical Officer and is overseeing the capacity of our hospitals and in particular the capacity of our ICUs and the provision of ventilation equipment to keep all Australians safe. What the Foreign Minister has taken you through is how we're caring for Australians abroad, and then what I'm looking at is how we're caring for Australians at home. In particular, there are two elements to what we are doing. Firstly, the containment, the bringing down of the rate of infection, and secondly, the boosting of capacity. Today I particularly want to focus on the capacity in relation to mental health as we head into Easter, with all of the challenges of isolation and loneliness and the support. But before doing that, to give a brief health update on what's happening in relation to our containment process. Just prior to coming to join you today, the National Incident Centre has advised me that there are now 6,068 Australians who've contracted coronavirus and, very sadly, 51 lives lost. Approximately 260 in hospital, 82 in ICUs and 35 on ventilation. All of those numbers are down from where they have been at their peak. I think that's a very important message as we head into Easter. All of those numbers are down. We've now reached 323,000 tests and climbing on a daily basis, one of the highest rates in the world with one of the lowest rates of positive cases. Very significantly, the curve continues to flatten. We are consolidating the gains that Australians, through their activities, have helped make a reality. Whilst we've been cautious over the last 2 weeks as we've seen the early data, what we're seeing now is a genuine consolidation. In the 24 hours to this morning's report, there was an increase of 96 cases. This is the first time in over 3 weeks that fewer than 100 people have been added to the list of those with coronavirus. That's an exceptionally important development for Australia. Fewer cases, fewer risks, fewer lives at risk. But we've got a long way to go. We still have a huge task, and I want to say as we head into Easter with welcome good news for Australia that the virus does not take a holiday. Therefore, none of us can relax in what we do. This in many ways is the most important weekend we may face in the whole course of the virus. If we can lock in the gains that we've made as a nation through the courage and sacrifice of those on the health and medical and policing front lines, but also through the immense goodwill and discipline of Australians, then we can help really protect Australian lives going forward and give ourselves the pathway through. Part of this job, though, is also building on what we've done with containment and expanding our capacity. In primary care, one of our critical tasks is the mental health of Australians. People are lonely. They're isolated. Many will be suffering anxiety. And so I am pleased to be able to say that going into Easter, we are now launching our new Beyond Blue coronavirus support program. It's the Coronavirus Mental Wellbeing Support Service. That will be available online at Beyond Blue. And so we would urge you to go to coronavirus.beyondblue.org.au, coronavirus.beyondblue.org.au, or to telephone 1800 512 348, 1800 512 348 if you are struggling, if you are battling. And it's the most human thing for people who might feel isolated, who might be lonely, who might be alone, they might be widowed or separated or just simply living by themselves. And so this is a very hard time. And if you can call somebody else, if you can give them the support they need, perhaps do the grocery shopping for them, to provide that support, you can not just help save lives and protect lives, but you can help somebody with the anxiety they are feeling. So this weekend, there is good news for Australia, but there is a warning that we can either lock in the gains or lose those gains. At the same time, we're building the support for people with their mental health challenges. I'd now like to invite Nick, Dr. Nick Coatsworth, Deputy Chief Medical Officer, to give an update on the developments of building capacity in our hospitals, our ICUs and with our ventilator support.
Thank you, Minister. As you know, one of the key elements to this response is to prevent in Australia one of the most tragic aspects of this COVID-19 epidemic, which has been the bottleneck that we've seen in nations like Italy, Spain and certainly more recently in New York State. And that bottleneck occurs in the intensive care units and is often based around the availability of workforce and capacity in the form of ventilators to be able to support patients with severe COVID-19 through their illness and to their recovery. The Minister has mentioned our successes so far in containment. At the same time, as you're aware, we've been building capacity over many weeks within the system. With particular reference to ventilators, we have set ourselves a national target of 7,500, building on the over 4,400 existing ventilators within the Australian system today. That target is well supported by acquisitions that we have made through ResMed, a company that does undertake ventilator fabrication in Australia. And as I announced last week, we have contracted ResMed to supply us with 500 invasive ventilators that can be used in the intensive care unit, and importantly 5,000 non-invasive ventilators that can be modified to be used in an intensive care capacity and will certainly be a useful option in the event of large cases of severe COVID-19 in the country. Minister Hunt, Minister Andrews, myself and senior officials had a teleconference with ResMed last night, and we are very confident with their ability to supply those ventilators within the coming weeks. The other thing that I'd like to share with you today, which is also of critical importance in securing our ability to ventilate patients with severe COVID-19, and something that Minister Andrews will elaborate on later today, is that we will move towards onshore production of ventilators in Australia, and that a contract has been made with an Australian company to be able to fabricate those. This is a major change in our manufacturing capacity within Australia to assist the ventilators that are already being procured from ResMed. Of course, a ventilator requires a workforce, and at the same time as this is going on, procuring the ventilators, we have had over 12,000 registered nurses enrol in our online upskilling to enable them to manage critically unwell patients. From a doctor perspective, we are looking at every doctor in the country who has capacity to manage an unconscious patient. In particular, a collaboration between our colleges of intensive care medicine and College of Anaesthetists to make sure our anaesthetic workforce is well placed to be able to move into an intensive care environment and assist in helping severely unwell COVID patients.